New South Wales officials say they haven't received advice to tighten restrictions just yet, despite authorities predicting a rise in COVID infections. Joining me live now is the New South Wales Health Minister, Brad Hazzard. Minister, good to see you. Thanks for your time this morning. We'll start off with the case numbers. How much higher do you expect cases to be?
Well, look, the University of New South Wales forecasting is indicating that we could see a doubling of cases in the next 4 to 6 weeks. But at the moment, the numbers in ICU are remaining relatively stable. I think we're up today to 47. I think it was 44 yesterday, and 958 in hospital. So it's not shooting up at the moment, but certainly the forecasts are that it could well do that.
Yeah, right. So if we're roughly at about 14,000 a day at the moment, if you're saying it's going to double in the next 4 to 6 weeks, what are we looking at, about 28, 30,000 a day?
I stress, Peter, that I'm saying that the University of New South Wales researchers are indicating that. It's certainly not a Brad Hazzard forecast. Brad Hazzard simply actually repeating what we've been told. So I think what the real message here is we know that vaccinations work. They work very well. We know that we've got a new variant, sublineage variant, as the doctors call it, BA2. We know it's more transmissible. It's not necessarily more severe. But if you have a lot more people getting it, then obviously a lot more people may end up in hospital. So, short message here is go and get your vaccinations if you haven't had any. And there's about, I think, more than 2.25 million people in New South Wales who've had their first 2 shots, but have just not got around to doing their booster. Go and get your booster. It's free. It costs nothing. You can get it at your GP. You can get it at your pharmacist. You can get it at a state health service. Just go and do it.
Okay, so at what point, back on numbers, at what point would some kind of restriction return?
Oh, look, I think that's. We have to look at, as we have for the last 2 and a bit years now, we have to look at the entire effect on our community. The epidemiologists, the public health physicians, of course, look usually at the narrow perspective of the viral effect on the community. But as health minister, and I think all health ministers around the country would be looking at all of the factors. So what's the effect going to be on mental health? What's the effect going to be on young people? What's the effect going to be on the economy? And certainly, whilst I've had some preliminary advice, and it was very qualified advice, it was advice that Minister, if this happens, then we might need to look at these various issues. But I'm not at all keen to be heading back down that path. And I think most of the community are tired. We've had it.
Yeah,
We've really had it.
No doubt about that. But is there a point? Is there a point at what part of that path that you would look at those minor adjustments?
Yeah, look, I'll take advice as we go, and obviously then we'll be discussing it with the relevant section of our cabinet here in New South Wales. But at this point, I'm certainly not rushing to cabinet with those suggestions. And I think Dr. Marianne Gale, who's filling in for Dr. Chant while she's having a well-earned break, she raised these issues with me last week on behalf of the public health team. But it was a very preliminary piece of advice. The document somehow ended up in the media before perhaps everybody was ready for that. And I've made it clear that we're listening. We're obviously being very cautious, as we have been right through this last 2 and a bit years, but not rushing anywhere to start putting more restrictions in place. But having said that, can I say, if you're immunocompromised, for a start, you should be going and getting your vaccines. If you've had your 2 doses and there's more than 3 months gone by, go and get your booster. If you've had COVID, 4 to 6 weeks after you've had COVID, go and get your booster. I've met people who say, oh, but Brad, we don't need it. We've already had the virus. No, folks, you need to go and get the booster. Go and get it 4 to 6 weeks after you've had it, or 3 months after you've had your first 2 doses. Go and do it.
Are preparations in place for a new variant? So just sorry to cut you off, especially in the lead up to winter.
Right. We're very, very aware of the fact that as winter comes, more and more people will be inside, closed windows, and that obviously increases the risk factors for all of us. So yes, we're working on those issues. What we're really hoping is that at some point in the not too distant future, we'll have a joint flu vaccine and a COVID vaccine, and I think that's very much on the cards. Can I also say, if you do get ill, if you do get symptoms, for heaven's sake, have a rapid antigen test. If it shows positive, go and have a PCR and get your doctor fast, because there are now treatments, not vaccines, but treatments that if they're administered fairly quickly, can actually head off a major illness. So there's a lot of reasons to be very aware of the fact that we're still in a pandemic. And I do worry that some people have just switched off from the fact that there's still a pandemic.
Just one more here. When are you looking at changing the isolation rules so that people inside their home, if someone tests positive, not everyone has to stay in their home for 7 days?
Yeah, look, that's something that was discussed at National Cabinet last week. I'm not part of the National Cabinet. That's the first ministers, the premiers and first ministers of the territories with the Prime Minister. And I understand the Prime Minister has obviously had some advice from ATAGI, that's the Australian Technical Advisory Group that advises the federal government. I must say at the moment, I'm looking at that with our team, but again, not rushing down to remove those careful protections while we're still a little uncertain about what's happening with the BA2 variant. So I've heard it. It'll certainly be discussed. But my position as the Health Minister is, again, not too keen to rush on that one either. So I think we just need to be just going about things as we've been going the last few weeks. Just balanced, sensible, cautious.
Brad Hazzard, thanks as always for your time. We'll talk to you again soon.
Pleasure.